Peace. Welcome, YouTube. Welcome to the YouTube live book reading. We're going to redo number 25. Welcome. The YouTube live book reading of Clinical Application of Respiratory Care. I'm your moderator and narrator, Uriel Riley, and we are in chapter 9. So, this beautiful medical book that we're reading to master ourselves, learn more about our anatomy, as well as so we can help heal others. So, Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. All right, so we're going to redo. Let's go. Chapter 9, page 164. We were giving a loving shout out to the great Michael Jackson, and today to one of my great nephews, this amazing young man, Sincere Ingram. I love you. You're doing it. Did it. Thank you, YouTube. Peace, peace. All right. Chapter 9, page 164 at the top. Humidity and Aerosol Therapy. The upper airway humidifies inspired air and thus maintains hydration of the mucus blanket. Disease processes interrupt this water balance and necessitate supportive measures to either prevent airway water loss or add water to the airway. The relationship of humidity to non-respiratory pulmonary function must be fully comprehended prior to discussing the clinical application of aerosol therapy. Humidity. Evaporation is the process of converting a liquid to a gas. Humidity can be defined as 1. Water in the gaseous state, and 2. Water vapor in gas, or 3. Molecular water in gas. The amount of water vapor a volume of gas can potentially contain is dependent upon the temperature. The higher the temperature, the greater the amount of water vapor that volume of gas can contain. The greater the surface area of water and gas, the greater the rate of evaporation. When a volume of gas at a given temperature contains all the water vapor it can possibly hold, it is said to be saturated. When saturated gas is cooled, a portion of the water vapor will condense, turn to liquid water. When saturated gas is heated, it becomes capable of increasing its water vapor content. Absolute humidity is the weight of water vapor in the gas volume. Traditionally, this is measured as mg, or milligrams of water vapor per liter of gas, mg over L. The maximum absolute humidity is defined as the weight of water vapor in a saturated gas. Table 9.1 illustrates that 37 degrees Celsius body temperature, air has a maximum absolute humidity of approximately 44 milligrams over liter. 21 degrees Celsius, room temperature, air has a maximum absolute humidity of approximately 18 milligrams over liter. If saturated air at 21 degrees Celsius was heated to 37 degrees Celsius, it would have an absolute humidity only 40% of the gas potential maximum absolute humidity. This ratio of absolute humidity to maximum absolute humidity is termed relative humidity. 50% humidified air at 37 degrees Celsius has a higher absolute humidity, 22 milligrams over liter, than 100% humidified air at 21 degrees Celsius. It is well to remember that when humidity is a concern, temperature must always be kept in mind. Hey, peace. YouTube, thank you for being here with us. We're reading Clinical Application of Respiratory Care, medical self healing books, and to help people assimilate to their MCAT. Thank you so much for being here and reading with us, celebrating MJ's birthday, which was yesterday, and my, my nephew, Sincere Ingram's birthday. So, reading in love with that in mind. At the top of page 165, table 9.1, relationships of humidity and temperature. The temperatures go as this: 37 degrees Celsius, 37 degrees Celsius, 37 degrees Celsius, 21 degrees Celsius, and 21 degrees Celsius. Now, and the absolute humidity would be corresponding 44 milligrams over liters, and then 22 milligrams over liters, and then 18 milligrams over liters, and 18 milligrams over liters, and then 9 milligrams over liters, and then the relative humidity corresponding 100% humidity, then 50% humidity, 40% humidity, 100% humidity, and 50% humidity. Thank you so much for reading books with us. Peace, highest heart love. Thank you so much. Highest heart love. Thank you. Yes, we're doing it. In this peaceful corner of YouTube, where we read books and learn from masters. I'm a master fitness trainer by trade, traveled all around the world and trained athletes. So I was telling a story last night of when I was in Istanbul training the Beşiktaş soccer team is when um, we got the message that MJ had elevated, and the whole place that I was in, it was a nightclub. It was basically just sobbing, and everyone just stopped. The music stopped, and everyone was just praying. Couldn't believe that elevation had happened for the great MJ because he was on tour overseas as well when we were over there. And everyone said he was just in amazing condition and the best they had seen him. And for him to pass, it was really tough. We want to dedicate these readings to him as well because he was one of the greatest light workers we've ever seen. So this is what light workers do. We honor one another. That's what this corner of YouTube we do. We honor one another. We uplift one another and love on one another. And I sing I love you at the end of each reading. So highest heart love. Top of page 165. This is the chart that I was showing you. Okay. I was just reading 9.1 table about humidifying the air and relationship of humidity and temperature. Airway humidification. Alveolar air is 100% humidified at 37 degrees Celsius and therefore contains 44 milligrams of water vapor per liter of gas. This water vapor exerts a partial pressure pH2, pH2O of 47 millimeters Hg. Under most climatic conditions on Earth, the water vapor content of inspired air is something less than 44 milligrams of water per liter. In fact, average U.S. room air conditions, 21 degrees Celsius, 50% humidified, have water vapor contents of less than 10 milligrams. The difference between water vapor content in alveolar air and inspired air is termed the humidity deficit. Ambient air inspired through the nose is warm to 34 degrees Celsius and is 80 to 90% humidified in the oral pharynx. It is 37 degrees Celsius and 100% humidified in the carina. If the same air is breathed through the mouth, it is 21% or 21 degrees Celsius and 60% humidified in the oral pharynx, but still 100% humidified and 37 degrees Celsius at the carina. Thus, if the water and heat are not supplied by the nose, they must come from the mucosa or and mucus blanket of the tracheobronchial tree. The insensible water lost primarily by the skin and the pulmonary tree, in the resting normal adult is approximately 1 liter in 24 hours. The pulmonary tree is responsible for approximately 250 milliliters. E- Even more than 250 milliliters is lost from the nasopharyngeal mucosa when 1. Hyperventilation occurs. 2. The inspired air is extremely dry, as it is ordinarily is when oxygen is breathed. Or 3. When fever develops. In the normal resting adult, the nasopharyngeal mucosa gives up approximately 0.35 milliliters of water per minute in changing ambient air, 21 degrees Celsius, 50% humidified, to alveolar air, 37 degrees Celsius, 100% humidified. If this rate of water loss were not counteracted by opposite forces, it would amount to over 500 milliliters per 24 hours. Since the actual loss is only 250 milliliters per 24 hours, it is evident that the nasopharyngeal mucosa must recapture about 250 milliliters of water per 24 hours from the exhaled air. Fluid exchange in the nose is best considered in terms of dehydration and rehydration of the mucus secretions. These secretions are produced in response to stimuli which are not completely understood. In cold weather, the mechanisms allow condensation of exhaled vapor to be reabsorbed by the mucus lining and reused for humidification of inspired air. Inadequate humidification of inspired gases by the upper airway will lead to an adverse change of events in the lower airways. When the upper airway is not functioning properly, the humidity deficit must be provided by the mucus blanket. This results in drying of the tracheobronchial tree, which leads to 1. Impairment of ciliary activity. 2. Impairment of mucus movement. 3. Inflammatory change and necrosis of ciliated pulmonary epithelium. 4. Retention of viscid tenacious secretions with secondary incrustation. 5. Bacterial infiltration of mucosa. 6. Atelectasis. And 7. Pneumonia. Peace, YouTube. Highest heart love. Thank you for reading with us. We're in the middle of page 166. We're redoing chapter 9's beginning again. So thank you for being here, reading books for us, with us. And this is a part of the book lovers community. So highest heart love and honor to all the book readers and writers out there. We love you here on this peaceful part of YouTube, where we read books and learn from masters. Humidifiers. Humidifiers are designed to deliver a maximum amount of water vapor without producing particulate water. The water may be at room temperature or heated. Water will transfer heat to the gas that passes through and allow for a greater water vapor content. The gas must cool to body temperature before reaching the patient. This cooling process causes water vapor to condense, rain out, in the delivery tubing. There are two major types of humidifiers in common use: the Passover humidifier and the bubble diffusion humidifier. Passover humidifier. The Passover humidifier is the simplest of all humidifiers and operates on the principle that water will evaporate as air is passed across its surface. Heated or not, this type of humidifier is not in exceptionally common use today except for some volume ventilators. It has been replaced by far more efficient humidifiers and nebulizers, and we know now we have the actual CPAP machine, which does all of this in one. One of my favorite tools to use in using and doing my Your Healing session. So last night I got back late, and that's why we were doing this book reading. And just honor all the healers out there. Love to you, all of you that have mastered your craft. That's why we come in and read these books, to reinforce our mastery, right? To reinforce the love and care that we have for one another as light workers on this world. The Passover humidifier is the simplest, yes. Bubble diffusion humidifier. A method of increasing efficiency is to break up the gas into small bubbles and allow it to come into intimate contact with the liquid. This provides a great gas to liquid surface contact interface and enhances evaporation. Figure 9.1 illustrates a basic model of a bubble diffusion humidifier. Although the actual techniques vary from one appliance to another, essentially it is a method of breaking up the gas into small bubbles and allowing intimate contact between the bubbles and the liquid. The liquid can be easily heated to provide for higher water vapor content. At room temperature and low flow rates, these appliances produce gas that is maximally saturated. However, when heated to body temperature, the relative humidity is seldom over 40%. The past decade has seen the jet aerosol gain great popularity as a means of better humidification. However, the bubble diffusion principle is still widely used for low flow oxygen systems, and some newer designs have proved very efficient. Peace. Thank you so much for the likes and subscribes. We made it to 500, and now we're pushing to 1,000 subs on a channel where we read books to everyone, for the people. It's my dream come true, and I'm just so honored to be able to do this and bring this work to you. Thank you so much for reading with us. We are on page 167 of Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. We're in chapter 9, just starting off and doing a redo. Newer designs have proved very efficient. Of special interest is a type of bubble diffusion humidifier made for mechanical ventilators that is known as a cascade humidifier. This appliance effectively breaks inspired gas into minute bubbles by a cascading process and passes these bubbles through water heated by an adjustable immersion heater. The temperature of the humidifier can be raised to such a level that the gas will be 100% saturated when it reaches the patient. Clinical application of humidifiers. All medical oxygen is stored in cylinders or liquid tanks. The oxygen delivered from these sources is anhydrous or dry and must be humidified prior to patient contact. Totally dry gas delivered to be a patient will have a rapid drying effect on the nasal and pulmonary mucosa. The bubble diffusion humidifier is a popular means for routine humidification of oxygen. Enough humidity is added to mimic the humidity of the room air. Thus, its purpose is simply to restore the dry oxygen to room air conditions. The advantages are the simplicity of the apparatus and its ease of maintaining sterility. Unheated humidifiers are used with small caliber tubing since the gas temperature will not decrease in transit to the patient. This means water condensation in the tubing will be non existent. Artificial airways. Heated 37 degrees Celsius and humidified 100% gas is essential when the upper airway is bypassed. But such air is poorly tolerated when breathed through the intact upper airway. Anyone who has been in a steam bath or sauna will attest to this fact. Remember, a humidifier can prevent airway water loss. It cannot add water to the airway. Heated humidifiers must be used with wide bore tubing since rainout is expected as a result of the cooling of gas in transit to the patient. Thank you so much for the likes and subs. Hi is heart love. Much honor. Thank you. Yes. The peaceful part of YouTube where we master ourselves and using the information and the books that we read on this YouTube channel, we use it to help heal one another as well as ourselves. Thank you so much for being here with us and reading. Happy Saturday. We're pushing to 1,000 subs, reading books here on YouTube Live. Sterility. Sterility humidifiers will rarely transmit bacteria because there is no particulate water. However, one must be careful since many jet aerosol appliances are used for humidity therapy, i.e., a nebulizer can be used for humidity purposes. Since this is a common practice in respiratory care, the respiratory care practitioner must be aware that such an apparatus can transmit bacteria. And we'll pause right here, continue back to chapter 9. We're at the bottom of page 168 when we reconvene. with Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. I'm your moderator and narrator, shaking it up in the world, reading books. Hey, 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 hey. Thank you so much for reading, shaking it up with us. We love you. We value you so much. Highest heart, love, and honor. Thank you for reading books with us. Much love. I want you to have a wonderful day. I will see you soon. This was a redo, and tomorrow we will reconvene with chapter 9. Thank you so much for the likes and subscribes. We're pushing to 1,000 on this peaceful corner of YouTube where we read books and learn from masters. Highest heart, love. Thank you so much. Oh, there's so much love. Gratitude. Again, love to all those that came before us. We honor you. Thank you for all you've done for us, for being the light workers in the world. Thank you for reading with us. Thank you for breathing with us. I love you. You know I do. Have a wonderful Saturday, and I will see you soon. Peace, peace.